This MMA fighter received a shot of adrenaline while awake. What in the world?
So what would happen if you took a shot of adrenaline, if you were a healthy person, not having an allergic reaction, not having a drop in blood pressure? Would you have a heart attack? So the doc here is correct. This is not a great idea. You shouldn't just be injecting adrenaline just for fun. This first thing to keep in mind is the concentration. When there's a cardiac code and they're giving 1 milligram of adrenaline, they're giving a 1 to 10,000 dilution. An EpiPen that we use for allergic reactions is a 1 to 1,000 dilution, so it's technically 100 times stronger. However, the dose is less. The maximum dose that's usually given in EpiPen is 0.3 as opposed to during a code where they give 1 milligram. Also, the route that you're giving it is different. When you're giving it in the muscle, it's going to get absorbed differently than when you give it directly into the vein like you would do in a cardiac code. That's why the dose that you give in an EpiPen, you should never give directly into a vein. You have to dilute it first. But as an allergist, we give epinephrine very often. And we have several people who accidentally inject themselves with their EpiPens. So what happens to them? Honestly, it feels like they took a shot of espresso for about 20 minutes, then it wears off. They have a slightly elevated heart rate. They might get a little bit of tremors. They might feel a little nervous. And within 20 to 30 minutes, they go back to normal again. The risk of a heart attack is actually very, very low. And usually the cardiac side effects to using an EpiPen, if a person has to use multiple of them. But honestly, the risk of an anaphylactic reaction causing a heart attack is more likely. That's why there's no contraindications to using an epinephrine pen during an allergic reaction. So in conclusion, don't inject an EpiPen just for fun. But if your doctor recommends an EpiPen during an allergic reaction, I wouldn't be worried about a heart attack. I'd be worried about the anaphylactic reaction not being treated. Hope that helps.